But before we delve into these very interesting topics, take a look at the health updates. Very informative health updates right there. And like we said, we are joined by Dr. Boniface Chitai, who will be discussing alcohol use and addiction. So maybe, Daktari, you can introduce yourself briefly.
Okay. I'm Dr. Chitai. I'm a psychiatrist and a lecturer in the Department of Psychiatry and Mental Health at the School of Health Sciences.
So, Daktari, please describe to us what is alcohol use or abuse or misuse?
Okay, so words such as alcohol abuse, alcohol misuse, just imply that a person is using alcohol in a pattern that is dangerous to their health and their functioning. There are words that are currently not used in the literature because they have been replaced with alcohol use disorder. So instead of saying someone is abusing alcohol, we will say that someone has an alcohol use disorder. They have been replaced, but they all imply that this person is the pattern of their use of alcohol is at a level which can be described as a disorder, meaning there's a disease in the pattern of use. Yeah.
So now that there is a disorder in the pattern of use, is there a safe limit of taking alcohol?
Okay, so safe, the word safe was once used, but now it's not used because it was found that also the word can be misused. Yeah, so people prefer to use the word safer use of alcohol or less harmful use of alcohol, because it has been found that alcohol use even in what is considered relatively small amounts could also have harmful effects. So what we say is safer, a more safer use or a less harmful pattern of use. But really tells you that alcohol has been used for generations in our own society, for celebrations. It has been used in funerals and other other ceremonies. So it's very old and humans have used it. However, it's always been found to have some challenges that while some people use it and continue to live their lives normally, others become addicted to alcohol, they become dependent, it affects people's lives, it makes people dysfunctional, and so on. So then it's found that however we cannot stop the society from using alcohol, we can only advise them stop. What has been advised is that somebody can use small amounts of alcohol spread out, not using alcohol on a daily basis. So there is what we call units of alcohol. So 1 unit of alcohol will be basically about 1 bottle of beer, or 1 glass of wine, or 1 tot of alcohol of about 40% concentration. So that is 1 unit. So it has been found that you could relatively be healthy if you use not more than 14 units of alcohol in 1 week. So those are very small amounts. So in a day, that comes up to around 2 units. Yeah, it comes around 2 units of alcohol. For 7 days, it will be around 14. Men usually are allowed have a greater allowance because of what we call the structure of a female has more fat, compared to water. So men can dilute alcohol more. That's why they don't get drunk as fast as females. So because of the fat to water ratio, females have a higher fat to water ratio. So the alcohol concentration in their blood will go up faster, while men, their blood will dilute it more than women. So men traditionally were given a limit of 21 units in a week as a safer level of drinking. So on average, maybe it's 2 beers per day, and you are advised not to drink more than 6 units in 1 sitting, because that one means binge. You are binge drinking if you take more than 6 units of alcohol in one sitting, and that also has been found to be dangerous. And then also the other advice is that at least have 2 alcohol days in a week. So don't drink continuously, even if it's small amounts. Have some 2 free days in a week. So basically, these are very small amounts of alcohol. It's maybe 1 glass of wine. Oh, yeah, it's probably 1 glass of wine, or maybe 2 tots, in a sitting, and so on. But it's basically very small amounts. That is what is called safer levels of alcohol use.
Okay. So, Daktari, you said a glass of wine, and it prompted the question that they say that a glass of wine is helpful for the digestive system. How true is this?
I don't have, that's a common saying, within the, one of those things that people say, but there's basically no proof that it's good for the stomach. I mean, what problem are you curing? That's the question. So it's one of those things people say, the one for the road, or taking some little to get sleep. There are many cultural practices around alcohol that people have adopted, but there is really no. In fact, use of alcohol can actually cause problems with your stomach, because it corrodes the lining of the stomach. So it's called gastritis. So basically, over time, it could lead to ulcers. So it may actually be bad. However, a glass of red wine, has been found that it can be healthy. Once in a while, a glass of red wine is said to be good for cardiovascular health, for the heart and for blood vessels. But again, these are very small amounts we are talking about. Not culturally and in practice, people actually take very high amounts of alcohol. You see, look at a bottle of 750 ml of vodka, for example. It contains around 45 units or so of it could contain up to 45 units of alcohol. So these are very, very high amounts, and a lot of times these are the amounts that people are actually taking, or a glass of, a whole bottle of wine. I don't know how many glasses will be there, but again, it will have slightly high. I mean, we can calculate. There's a formula that we use for calculating the amount of alcohol. Take the alcohol, you divide by in mLs, you divide by 1,000, and you multiply by the percentage concentration of the alcohol. And I know that most of the wines are about 10%. So if it's a 750 ml of wine, that will be around 7.5 units. Again, you see, if you take 1 bottle of wine in a day, you've gone past 6. So you are at 7.5, which is slightly above what you can call a safe limit of use. Yeah.
Okay, so Daktari, there's also a common phrase on social media that when you start vomiting, when you've taken alcohol, that's your body's response to protecting you from the harmful effects of alcohol. How true is this?
Yeah, by the time you start vomiting, you are approaching poisoning. Alcohol poisoning. When you take alcohol, the body breaks it down into what we call metabolites, or the products. These products that are broken down by alcohol are very toxic to the body. Some of them are carcinogenic. One is called the bigger or the greatest percentage of alcohol is broken to acetaldehyde in the body, which is carcinogenic. So it can actually cause cancer. But even in those, when it accumulates, when you start taking, it starts to accumulate. So most people, by the time you're getting drunk, the amounts of acetaldehyde in your blood, concentration in your blood, are quite high. When they are high, you get those symptoms. So it is flushing, it can be low blood pressure, it can be, confusion, nausea. And so it is because of the accumulation of the byproducts or the products of the breakdown of alcohol. It cannot be the signal that now you need to stop drinking. I think if the drinking should be, a person who drinks should decide how much they want to drink beforehand, and it should be based on the limits that are safe scientifically, which again are the ones that we are mentioning, rather than waiting until you are experiencing these effects so as to stop. Yeah.
Do not move a muscle. We will be right back after the short commercial break. But before then, take a look at the Did You Know segment.
Badala ya kutafuta kazi, tunaweza kuanzisha miradi yetu ambayo ingetusaidia kubadilisha maisha ya wazazi wetu.
Kwa vijana wenzangu, wengi hawana kazi, lakini ikiwa sisi wenyewe tutajiamini, tunaweza kujiajiri wenyewe.
Afrika kwa kweli tuna mahitaji ambayo ukiyasuluhisha unaweza kuathiri watu kwenye bara hili
bila uoga. Watu huwa na uzalishaji zaidi, wanajawa na ujasiri, wanakuwa wabunifu na wanakuwa wenye maarifa.
Niliamua kuacha kazi. Hata kama sitafanikiwa, nitakuwa nimejaribu, nitakuwa najua haiwezekani.
Hakuna kitu cha ajabu hapa. Kila anayepata ufanisi hufanya kazi usiku na mchana.
Kitu kitakusukuma na kuwezesha kupata maarifa ambayo hukuwa nayo.
Tunajaribu kutengeneza kitu kitakachopita mipaka nchi hii.
Ikiwa unataka kubadilisha ulimwengu, anza na nyumbani.
Mwogopeni Mungu mtukufu. Kwa nini tumwogope Mwenyezi Mungu Azza wa Jalla? Kwa mambo gani ambayo kwamba tunafaa tumwogope Mwenyezi Mungu Azza wa Jalla? Leo watu wanaishi hata afadhali wanyama. Watu leo wanaishi katika maisha ambayo kwamba hatujali kama kuna Mwenyezi Mungu mtukufu. Yale mambo ambayo kwamba tunayafanya hata hatushtuki, wala tunaona tu ni mambo ya kawaida. Tunaona kwamba tu haya mambo bora yafanyike.
Kaunti maarufu kwa kuzalisha maziwa na ukuzaji wa majani chai. Pia, serikali ya kaunti inawahimiza wakulima kukumbatia mitindo mingine ya kilimo kuzidisha mapato.
Kama kuna kikundi moja inafanya biashara ya kuuza kuku, hao pia tumewafadhili kuwafunza jinsi ya kuhandle zile kuku kwa sababu wanaleta kwa wingi.
Haya yote tunakuletea katika Boresha Kilimo, toleo la kaunti ya Bomet.
Kilimo ni nguzo kubwa kwa ujenzi wa taifa.
Bajuka ni kama unarusha mamikono, tingisha kichwa chungo sivute kisono.
Mbona nyinyi na wawasha nkikula nyama choma tu firifiri na
give me your hand and shoulder. I'm feeling vibes on vibes. I'm a ticking diner.
Tell them twerking, pull up the lambas I work so hard, you know I don't want no stress. I don't get time to impress. Caught a girl with a lovely dress. Yeah.
Welcome back to Focus on Health, and like we said, we are having a conversation on alcohol use with Dr. Boniface Chitai.
Yeah.
So what exactly is a blackout? People say that I blacked out. What happens during that?
So a blackout, in the simplest of terms, is the fact that alcohol has in the brain acts as a depressant. In the first few minutes of taking, it's a stimulant. It makes a person excited. But as you continue to take, it becomes a depressant. So it reduces your the capacity of your brain to function. So what you call cognitive functions, alertness, memory, your ability to plan. There's what you call inhibition, preventing you from doing things. We prevent ourselves from doing things all the time. So when you take alcohol, you will depress the central nervous system. And so one of the things that goes down is your level of alertness, consciousness. So when you black out, you have actually gone into a coma. It's an indication that the concentration of alcohol in your blood is very high. And the next stage after coma is usually death. Okay, most people black out, but they don't die. But it's risky. When if constantly you're taking alcohol and blacking out, is a sign that you are taking very high amounts. And these high amounts, even if they don't kill you instantly, they may be causing a lot of damage to your body, like the liver, for instance, may be getting damaged because of these high amounts. So it's not a good sign to take alcohol and then black out. It means you took very high amounts.
Okay. So are other people more predisposed to blacking out than death compared to others? Because some people will drink, black out, the next day they drink, black out, but they don't die. But there's someone who, after excessive consumption, will die. Can you please comment on that?
Yeah, the truth is that as you start taking alcohol, when you are naive, you get drunk very fast. Yeah, you get drunk very fast because also your body does not know how to handle this alcohol. Yeah, but as you continue taking, the body adapts. So the amount of enzymes that are breaking down the alcohol also increases. So you find people can take high amounts of alcohol, but they're not getting drunk. Yeah, it's because their bodies have now sort of adapted to high amounts, but the damage is still going on, but to a less extent. So that's what the difference is. So for someone whose body maybe just began drinking alcohol, or a small child, they could be harmed by a high dosage of alcohol at once because their bodies are not adapted to the high amounts. Yeah.
So what exactly is the physiology of a hangover, and how do we get over that stage?
Okay. So hangover is just a component of, someone has taken alcohol, a large amount of alcohol, and then they stopped. Okay, high amounts of alcohol and stopped. So typically it's experienced the day after someone has taken alcohol. So part of it is your body is withdrawing from the alcohol. So what you experience during hangover is in a way the opposite of what you experienced during when you are getting drunk or intoxicated. So it's sort of the opposite. So when you are, if you're feeling maybe if you're feeling sleepy during alcohol, maybe during the hangover, you may find that you are unable to sleep. You may feel anxious. You may feel nauseous. You may feel maybe headache. It is caused by the accumulation of the byproducts of alcohol, of alcohol, like acetaldehyde and so on. So for most people, it just lasts for one day. Yeah, and then it disappears. It's because now the acetaldehyde has been broken down in your body. I mean, if you just wait, it will go away. You can take water. Sometimes depending on the amount of alcohol taken, you may just have to wait for it to go away. Some people take more alcohol. I think that's not a good strategy. Yeah, because you're causing more harm, with the more alcohol you are taking. So perhaps the better option is to maybe take water and just give yourself time and at a period of abstinence. I think hangovers are good. Hangovers are good because in the general strategy of trying to control use of alcohol, as health providers, we try to discourage the use, okay? Part of how people take alcohol is through learning, or how they continue taking is through learning. So you take, you feel good, you will continue. Anything that makes you feel good is likely to make you do it more. all right? Because there's a reward. Your brain feels good. That's why people take alcohol and other drugs. There's a good feeling. We can't say it's all bad. There's a good feeling. So the hangover is the negative aspect, okay? So it discourages people from taking. So the bad experience that somebody goes through is part of what basically can also be a deterrent for people. So as healthcare providers, and by the way, there is also part of treatment. In part of treatment, sometimes we give you a drug that can react with alcohol in a negative way. It's called disulfiram, so that you experience the negative effects of alcohol. And so you'll tell yourself that this alcohol is making me feel very bad, and therefore I'll not be able to continue. Actually, there's a genetic mutation among a certain group of Asians where they are unable to break down alcohol properly or promptly. So their breakdown is very slowly, and therefore they are like allergic to alcohol. Anytime they take alcohol, they experience as if they have, taken that medicine we give. It's called disulfiram. So around 40% of the Asian population have that natural mutation. So they end up not taking alcohol because of the reaction. But all in all, a hangover is a good thing, because if it was not there, more people will take alcohol in harmful levels.
Okay, maybe you can also comment on the common kutoa lock narrative. Could you please comment on that? Just like you've said, more people take alcohol even during the hangovers in order to offset the feeling of depression. Could you please comment on that?
Yeah, so there are people who use alcohol the first thing in the morning. Yeah. So if somebody has to take some alcohol in the morning before they start their day, it's one of the questions we ask when you are assessing who may be at risk versus who may not be at risk. So if you have to take alcohol in the morning during your to start your day, it could also mean maybe there is dependence. Maybe you are dependent on that alcohol, right? And two, the reason why people do that is to prevent withdrawal symptoms. So you've been taking alcohol for some time, your body is used to it, alcohol depresses the central nervous system, and so if it's not in your body, you're not functioning, there's almost a nervous breakdown. Someone is having tremors. Some people actually have hallucinations. Others can have convulsions. Yeah? Others just nausea, headache, lack of sleep, and all these side effects or withdrawal symptoms. Or anxiety. Some become very anxious. Yeah? So if you take the alcohol, you can immediately feel good, and maybe you can get started on your day. But it's a sign that someone may be suffering from, withdrawal symptoms, which is also a sign of very serious, alcohol disorder. Yeah.
There's also, before even we get to the psychosis part of alcohol, there's also a trend where people take things like diclofenac, paracetamol, in order to not feel the effects of hangover. Could you please comment on that and also the benefits versus the risks?
Yeah, you see, eventually, alcohol, for some people, is taken to treat their diseases, okay? Mental problems, including depression, including anxiety, and maybe others. So that's one of the reasons. However, alcohol also causes some painful outcomes, complications in the body, including the brain. What you call the mind is part of the brain, okay? So human beings will always treat themselves, So if I feel pain, the natural reaction is to go and get some painkiller. So I think each individual has their own way of dealing with what is called a hangover, you know, how they feel afterwards with the effects of withdrawal from alcohol. So every individual has their own way. Some use paracetamol, some use diclofenac. I think using these drugs, small amounts may have no harm, but it's good to be aware what effect they can cause to your body. Like diclofenac, excessive use can cause stomach ulcers, you know, and paracetamol, excessive use can also cause things like liver damage further. So it's good to be aware what the risks are.
Okay, so Dr. could you please talk about illicit brews and why do they cause blindness? We've seen this so much on the media.
Okay. Yeah, so the illicit brews are the normal alcohol that people take is ethanol. Yeah? It has its own chemical formula. Yeah? It has 2 carbon atoms and a bunch of hydrogen and oxygen. Yeah? It has 1 oxygen. Methanol has 1 carbon atom. Yeah? And it's metabolized to different. We told you for alcohol, whatever comes out is toxic, but for methanol, it's even more toxic. Yeah? So this more toxic can cause damage to the optic system, you know, starting with the nerve, yeah, to the optic nerve, and that can end up leading to someone getting blind. Even small concentrations. I think up to 10 ml of methanol will usually cause blindness, and 30 ml of methanol will cause death. So those are very small amounts. It means if you take, and so they mix alcohol, normal ethanol, with the methanol. So you can see if you take 1 tot of that methanol, the pure one, you go blind. So it could be 1 ml is in 1 cup, or equivalent. So if you take something equivalent to 30 ml, you die. That's why many die. You find larger numbers of people have died. Yeah, because you need only small amounts to affect you. So that's for that reason. Yeah.
There's also a misconception that the higher the price the alcohol, the lesser the effects compared to the cheaper ones. Is that true?
I'm not an expert on quality of alcohols, but cheap is expensive. Yeah. So even these alcohols you're talking about that guys use and go blind and die are very cheap. Yeah, they're very cheap. So I will not trust very cheap alcohol. Yeah, yeah. But it does not mean that if alcohol is expensive, it is outrightly safe. It will still have the effects that we have talked about. And these are effects that people suffer from, even in countries. In Kenya, it's now common knowledge, and people have talked about how we have fake alcohol everywhere, you know, from River Road and Kariobangi. But even in countries like the UK, where we may not have this fake alcohol and where they take only the fine whiskies, they will suffer from these effects, the harmful effects to the body, liver, cancer, and mental disorders as a result of use of alcohol. So the danger is not removed, but the fake alcohols and the cheap and fake, you know, sometimes they can go together. The effects, I mean, there's a risk that they may be adulterated or they're made in unhygienic conditions. There is something that is compromised. That's why they are cheap. Yeah, there's something that is compromised. So, yeah. But having said that, we should not create an impression that if it's expensive, then it is harmless.
Okay. Also, Dr. could you comment on why other people tend to get liver failure while others take a long time still using alcohol and do not have effects?
That also, that's the same reason why some people get some diseases and some don't. You know, for some it could be because of genetic reasons. As I have told you, alcohol is broken down, enzymes are involved, and you may have learned in biology that enzymes are proteins. So some people may have a capacity to break down alcohol faster than others. So if you break it down faster, you're better off, because it becomes harmless, But if you take time to break it down, or if one of your enzymes is low, so you're accumulating these poisons more, you are likely to suffer from more damage. So it will vary from person to person. But also it could be as a result of what other factors are there, what other factors are there, Like I've told you, we have other harmful things that harm the liver. So it could be, probably someone is also taking another drug, so the liver is overwhelmed, that can lead to greater damage. But again, from studies it's been shown that liver damage is also more common in women than men, It could be because, again, the capacity of women to dilute the alcohol is lower, But also, a good news is less women have alcohol use problems than men. All over the world, men are likely to have alcohol use problems 6 times more than women. So that's a good thing. And it's also been studied that between men and women, men tend to inherit their alcoholism from their fathers. Okay, so it looks like there could be something. I think more studies may go on, But a guy called Cloninger did some study on adopted children, and one of the conclusions was that most of the men inherit from the father. Ladies tend not to inherit from the father, but they tend to inherit from the mother. So if a lady if a lady has a mother who takes alcohol, they are more likely to be alcoholic than for men.
We have come to the end of our discussion on alcohol use, and on the next episode, we will be discussing alcohol addiction alongside Dr. Boniface. Make sure to stay tuned. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy. I'll leave you with the Healthy You segment.